Hello and welcome to my first YouTube video on this channel. My name is Vanessa. I'm 28 years old and I'm a first-time mom to a about to be 15-month-old boy, and I felt inspired to make a video about my breastfeeding journey and how I went about weaning, because I feel like that's something I wish I found a video on, just talking about what I was going through. Obviously, every breastfeeding journey is very different, as well as the weaning journey. So that's kind of what I wanted this video to be about. I wanted to share mostly about what I did to wean my baby at 13 months, practically cold turkey, and I just feel like, yeah, my experience is pretty unique, and if you're also going through that whole process and journey, that maybe my story can help you or just give you some insight, and yeah, hopefully it just be as helpful as possible, because that was something I was looking for when I was going through the ups and downs of my breastfeeding journey, and also just navigating weaning and trying to figure out how I'm going to go about it, especially because I did ultimately make the decision to do it somewhat cold turkey, or I guess my son technically did, but we'll get to that. I'm going to start at the beginning with just when my baby was born, my first experience with breastfeeding, and how it did not meet my expectations, in the sense that it wasn't what I thought it would be. And I just have to first say that, like, my pregnancy was super chill. Let's just say my boy is very chill. I had a very chill pregnancy, very mild first trimester, and I just tell everyone I was hungry, very, very hungry, and tired, but that's it. And yeah, I had a very, very wonderful pregnancy, very easy, I would say, very blessed. I know it's just so different for every woman that, you know, carries a child, and I find that so fascinating that everyone's experience is so different. There's no like cookie cutter experience of being pregnant. So yeah, chill pregnancy. My labor was also pretty easy, I would say, as easy as labor could get. I did personally choose to do an unmedicated home birth. Yeah, as intense as it was, I'm glad I did it, and I'll do it again. This leads up to, you know, my first attempt to breastfeed when my son was first born. It was probably within the first hour that he was born that I tried to get him to latch, and he could not latch. I did have a midwife there, and she did her best, but it was just like a matter of waiting, we felt, until he would like kind of wake up and figure out, I guess, that natural instinct to like look for the breast and try to latch. And he did try, but it was difficult, and did not have really any success that first day. My midwife went ahead and brought me a spare pump that she had, and also some extra breast milk, or like frozen breast milk, and and basically what I ended up having to do, because I was just having colostrum at the time while I was pumping, is I had to feed my baby with a syringe for probably the first 2 weeks of his life, because he could not latch, which I guess that kind of breaks my heart that I didn't have like that, I guess, stereotypical experience of your baby's born, you put them on your chest, and they just like magically know how to breastfeed. Like, it was not like that at all, and I didn't know what to expect. I had read as many books as I could have during my pregnancy, but nothing really prepares you for what you're actually going to experience until you're there experiencing it. So yeah, he was syringe fed. I would pump the colostrum, put in a syringe, feed him with the syringe. There was like this tube, and I had to like kind of put it in his mouth with my pinky so he could suckle on my pinky, and then kind of pull the colostrum down from the tube. And that was not fun, just because, I mean, freshly postpartum, I would have to sit up, and he would be in his bassinet, and I'm just like hunched over him, feeling so uncomfortable down there, but having to like feed him, and my husband would help and hold a syringe, and it was very chaotic. It was just not a very peaceful experience breastfeeding him. It was just like, quick, we gotta do this. It was just rushing. And then, yeah, my milk came in. Thank God I had a wonderful milk supply. I had just enough and a little bit more. So, yeah, it was like the perfect amount of milk, and I relied heavily on the pump. I did not want to pump. I did not plan on being a pumping mom, which I wasn't really, but throughout my journey, I did have to pump quite a bit just because he could not nurse for whatever reason. I'm glad I had it, but it was just like, that was very hard on me mentally, personally, just feeling like I'm forced to pump when I don't want to pump. Shout out to all the moms that choose to pump exclusively, because that's a lot of work. Not for me. I did not want to do it. But I did what I had to do to feed my baby. So again, I had a good milk supply, and I tried to do a freezer stash. My boy was just not a fan of the deep or the freezer milk. It had a different taste, but that's besides the point. Very early on, she suspected that he had a tongue tie. So this kind of like made it difficult to obviously breastfeed, and we just had to kind of figure out what are our next steps. Well, I guess another side note, my boy was 6 pounds and like, I forgot how many ounces, but he was 6 pounds. He was a little baby, and I thought that like, oh, he'll grow out of it. Like, he's just so small. His mouth is so small. He's going to get bigger, and then he'll be able to latch better. But still, like, the knowing was there that he most likely has a tongue tie. So we, in the meantime, while I was like trying to figure out what to do with his like tongue tie or trying to get it confirmed, my midwife also gave me nipple shields, silicone nipple shields, and those were a lifesaver. I did not know they existed until that moment. But yeah, she brought that over the same day she brought over the pump. So basically I would attempt to breastfeed as best as I could, and then I would also pump. And then I got a lactation consultant to come over, and yeah, so she confirmed the tongue tie, but he had an all-around mouth restriction. So he had the tongue, a lip tie, and then his cheeks. So it's like a buccal tie, I think what they're called. So this poor child, his mouth is like that, because he was just, there's so much restriction. And with that confirmation, we kind of knew that like, okay, this isn't gonna fix itself, basically. Like, he's not gonna grow out of it. This is gonna cause other issues down the road. There's definitely levels of severity. His was pretty severe, and I mean, again, he could not, like, he could latch, but he could not stay latched. It was difficult for him to retain the suction. So yeah, there was like that frustration, and so that's why I ended up having to pump a lot. Is even with the nipple shield, it still made it difficult. Saw the lactation consultant, and the first thing she recommended for us to do prior to getting the surgery done to revise the tongue tie is to go get body work done for my baby, and like fascia release. So we saw a lady that did the fascia release, and she did it for like, I want to say a couple of hours, and I also did not know this type of body work existed. We're just learning about fascia and how it plays a role, but basically, like, you know, imagine your baby in the womb, they're all curled up, and then as they're born, like, they have to unwind, and that's why there was like this tightness in his mouth, like all fascias throughout the whole body. Look into it, it's fascinating. But yeah, she just basically helped his body to relax after being born. And that 2-hour session made the biggest difference in just his facial posture. His mouth relaxed, so the whole time it was just very like kissy kind of lips. And then afterwards, his mouth would like relax. He had like regular, I guess, expression on his face. He could smile, and he could open his mouth a little bit bigger. So that made the biggest difference. And I know to some parents, they experience also a change in their mood and all that, or just because the baby's just more comfortable in their body. I can't say I experienced that, but there was a definite difference in his mouth after that session. And this was like a few days before we had to go fly. Okay, this is another story. So we lived in Hawaii, Kauai, the island of Kauai, and so we had to fly to Oahu to get this procedure done, and it was just like a day trip essentially. But so yeah, we fly to Oahu, he gets the procedure done, and then we have to go about the recovery. So it's like a 6-week recovery where you have to stretch it the wound sites multiple times a day so it doesn't heal back the way it was. That was traumatic. Like, blood curdling baby cries is horrible to hear, but it had to be done. So we did the procedure when he was 2 months old. So for 2 months, it was just kind of a chaotic struggle to get him to breastfeed. I mean, he's obviously having to figure out how to use his like tongue and his just mouth all over again after the procedure, and it was painful. So he refused to breastfeed. There was a nursing strike, so I had to pump more. It was just very chaotic and like mentally hard, because I'm like, why am I not getting this peaceful breastfeeding experience that all these other women experience? And at that point, I'm like, people say breastfeeding it feels good, or it's just somehow like there's a satisfaction in it, but I didn't feel that for the longest time because it was just so much work just to keep my baby fed. He was gaining weight perfectly fine. Like I had plenty of milk, so that wasn't the issue. It was just having to like figure out breastfeeding all over again from the 2-month point. And I would say until from 2 to maybe 5 or 6 months, it took a few months for him to figure out how to nurse again. So at that point he started getting his teeth because he was like 6 months, and then I experienced my first round of biting, which didn't happen actually until maybe he was 7 or 8 months old. But still, it just throughout the whole journey, there would be periods where he would end up teething, and this is common, I hear, for them to start biting when they're teething. And I went about trying to correct the biting, and I looked up on like YouTube and then Reddit how to correct the behavior. They recommended unlatching them, saying no biting, giving them a break from the boob for like 15 minutes, and then attempting again. I tried that, and then another person was like, multiple people, actually, very many people said like, oh, you kind of like flick them on the cheek and say no biting, and then also take away the boob. He hated that so much that he went on a month-long nursing strike because of that. Maybe it'll work with your baby. It did not with mine. So yeah, I was also, once again, forced to pump exclusively, almost. So my situation with like pumping was basically, I would nurse him normally throughout the day, and then I would pump at night for his last like meal of the day before going to bed. So yeah, I would essentially pump one time at night before bed, and that was it. And then he would nurse typically very well at night. It was just daytime that there was just a lot of shenanigans, and it was not relaxing. It was not relaxing at all. It was just like, oh my gosh, my nipple shield, where is it? So I did this for very many months. I don't remember exactly when I started pumping one time at night, but I did that pretty much until the very end of our journey, and that's just kind of what I ended up sticking with. I did not think that this is what I was gonna do. Oh, this is why. I think it was actually around when my son was 3 or 4 months old, he stopped nursing to sleep, and this was something I did not know was a thing. As far as I've read and found out or learned, everyone just has this experience where they nurse their baby to sleep for a long time, like months on months, until like even when they're like a year or 2 old. And here I am, my son is like barely 4 months old, and one night I'm nursing him to sleep, and I'm done nursing, but he's still asleep. I'm just looking at him like, why are you still awake? And then then begins the whole fiasco of having to do additional things to get this boy to go to sleep at night, like baby wearing him, bouncing, walking around, all of that. And that's essentially why I ended up pumping that one time before bed, because even then, for a while, I would give him that nighttime bottle, and that would put him out, and then at a certain point, that also stopped working. So I would still give him his last bottle, but then I would have to bounce him to sleep. I'll probably make another video as far as like our sleep situation goes, and or just how we navigate naps, and then also like nighttime, because maybe that can also be helpful. When my son started eating solids around 6 months, he already had a pretty good appetite, and that just continued as he got older. Even now, he's such a good eater, and I think that maybe played a role into him weaning sooner. My initial plan was to wean him after when he was about 1.5 years. So we're currently in the process of moving. Actually, right now I'm in my parents' house. We're just staying here for a month, and this is a whole other video, but we're moving to the Philippines, and my plan was to wean him after we got to the Philippines, just because with like a lot of change in life, moving, being in a different environment. We moved from Hawaii to, well, we're moving from Hawaii essentially to the Philippines, but we're staying at my parents' before we go there. So it's just like a climate change as well, being in a tropical environment to it snowing right now. That's why I'm all bundled up. So I just wanted to wait until we were in a stable environment to go about weaning, because I just didn't want there to be so much change in his life. But this boy kind of decided on his own that I guess he was going to stop nursing, and it just came out of nowhere. It was very like sudden that I'm like, oh, is this what's happening? Because basically, as I mentioned, he went through periods of like teething and biting. It was like every 2-3 months we would have an episode for like a week or two. The worst one being the very first time it happened when he went on that nursing strike. The second time, I think it happened maybe 3-4 times in total, where he would be teething, he'd start biting me, and I would essentially have to pump during the day. I would still attempt to nurse him, but when he would start biting me, I'm just like, I can't do this. So I would nurse throughout the day, and then I would pump throughout the day, and then he would still nurse good at night. So night times was no issue at all. But then this last time, and this was during the time that we were also like packing up all of our belongings, or just getting rid of our belongings in Hawaii and preparing to, ship our belongings to the Philippines. So we were just in the process of moving. It was already chaotic, and there was just a lot that we had to juggle. And just like the mental load of everything that we have to figure out for our move. And prior to this last episode of biting, I got to fully experience the joys of breastfeeding. And it's like bittersweet talking about it in a way, because after all of this like chaos and the tongue tie and recovering from the tongue tie and all the biting and pumping, I got to a place for 2 months where I didn't have to pump even for that last nighttime bottle. I decided okay, let's experiment not pumping and see how he's gonna sleep or nurse. And yeah, I had a solid 2-month stretch where I didn't have to pump whatsoever. He nursed like an angel. It was a wonderful experience. It was just it was peaceful. It was just enjoyable knowing that he's nursing good. He finally figured out how to nurse good, and it wasn't stressful. And I'm so grateful I got to experience just those 2 months. It's okay, that's what I get. I had a lot of learning. We both had a lot of learning to do in those first few months. And then out of nowhere, he gets sick for the first time, and he has a fever. It's he's not so sick, but during that night when he got the fever, he bit me for the first time, and it was just a little nibble, but it kind of caught me off guard. Whoa, we haven't done this in forever. Are we doing this again? And I didn't think anything of it. He slept good that night, and then the next morning when I went to nurse him again that morning, he bit me again, and I was like, oh, okay, so we are biting again. And I did what I normally do, where I'm like, okay, I guess, you know, I'll pump because I'm kind of uncomfortable. I'll just pump and kind of go about my day. But throughout the day, like, he just kept biting me, and at this point, I was nursing him, well, prior to the biting, I was nursing him on demand. And this is just another side note for my baby and his personality. I should have mentioned this sooner, but he never really nursed for comfort. It was just straight up like, I'm hungry, and that's it. And that was when he first woke up in the morning, and then after he would wake up from his naps. And that was it. If it was in between the day, like, he would just push my boob away and would not want it. So I'm like, okay. I also did not know that was really a thing. I've always heard about just babies wanting to nurse for comfort, and that's just like the cycle that mothers are stuck in, whether they like it or not. Like, you are the baby's pacifier, but I never felt like that, and it didn't bother me so much. I thought it was actually pretty, I guess, neat for, you know, my personality, and I was like, okay, you know, my boy wants to nurse when he's hungry, end of story. And obviously he was eating solids and all that. But during that 2-month good part, he ended up nursing for comfort a little bit more. And so yeah, I just kept offering him the boob. He would keep biting me, and it was just, it got that time specifically, that third or fourth time that he bit me, it really took a big mental load on me, and it had never affected me like this mentally before. Like, it was still hard, there was still tears and just feeling like, oh, I gotta pump, but this time it was like, it really hit home that first night, when I kind of figured it would be like all those other times that he bit me, that like, okay, I have to pump during the day, and then he'll nurse good at night. Because that's even, yeah, he just never bit me at night. And then this time he started biting me at night, so I was forced to pump during the night too, and that was like 2, 3, 4 times, depending on how many times he woke up. Or it was just like, I got so burnt out, essentially, with like that whole experience, and it was traumatic being bit. I mean, imagine, you know, it doesn't feel good. He would ask for milk, but then he would just bite me, so I couldn't figure out, like, there was like a disconnect in the communication. And then I think on the 3rd day of this nursing strike, essentially, where I was having to exclusively pump during the day and night, I started thinking, like, I don't know if I can do this. I would have like, not a panic attack, but a full breakdown. There was just so much crying, and I didn't want to feel like that for who knows how long. And I try to be strong, but I kind of came to the thought that maybe I have to wean now. Thus begins the weaning journey.